Hello everyone, I'm Dr. Shrikant Patil. Today we thought to give you an outline how antibiotics are used in hospitals, and that's why this is an attempt we made to bring it to your light about generalized usage of antibiotics when it comes to hospital setups. There are multiple factors which play important role while choosing an antibiotic in hospitals. Now remember, we are talking about injectable antibiotics and not oral over here. First of all, what doctors see when patient comes to him, he has to look for what is the source of the infection, what type of infection it is, whether it is a pneumonia, whether it is a case of urinary tract infections, or it is a case of intra-abdominal infection. Similar way, once he identify the type of infection, obviously he will conduct certain investigations and blood reports will be sent. At the same time, on day one, doctor does not know what type of bacteria is causing that infection. To identify that bacteria, he will send a report for culture and sensitivity, which is also called as a antibiogram. Unfortunately, this antibiogram will take at least 3 days to show us the result. So in this first 3 days, it is doctor's insight and his experience, his knowledge. Based on that, he has to take a call, he has to suspect that probably what is the underlying bacteria, and accordingly he has to start antibiotics. I'll give you an example. If a patient comes and he's diagnosed as a pneumonia on clinical examination and chest x-ray investigations, if there is a prior history of underlying lung disease like interstitial lung diseases, then possibly the causative organism is Pseudomonas. So accordingly he has to take a call about choice of antibiotics. Another thing is, what is the sensitivity pattern in my hospital or my nursing home also matters in this regard. Based on my previous data, I can choose the antibiotic for this particular patient. One more important aspect which is related to the patient, doctor has to take into consideration, that is what is the age of the patient, whether he's a child or he's an elderly aged patient, how is the immunity of the patient, and his renal impairment status. All these things also matters. And apart from that, the severity of infection. Now how the severity of infection is assessed? It is based on various multiple parameters, including vital parameters like heart rate, pulse, blood pressure, urine output, temperature of the patient. All these things are considered under the vital parameters. Whether they are deranged, what is the orientation of the patient, whether patient is conscious or unconscious, all these factors to be considered for choosing an antibiotic.